Good evening. The news gang is here, and tonight, 1,000 ways to get the virus in Kenya. Does anyone care anymore? The testing, the numbers, and the curve. Also on the show tonight, the virus and the border. Magufuli locks out the trucks. Uhuru seeks freedom for Kenyan drivers. How will this end? Plus, kicking Kindiki out. It is all set. On the punchline, Waititu goes to town to buy clothes. The memo is a cry for the Kenyan nation. So much for young parliamentarians, says the kicker, while the angle is divided between stigma and privacy. And Yvonne's take, she'll be back next week.
Fellow Kenyans, friends, yesterday I informed you about our rising numbers. It is worrying that this trend is continuing. Today, we have recorded the highest number yet again at 80 from a sample size of 3,102. This is the largest sample size tested so far.
We project now our peak will be around August, September, in which case we'll be reporting about 200 plus cases per day. That is if we continue with the measures and interventions that we put in place today.
Wow. So Dr. Moth there saying some very worrying things. Even behind that mask, you can say with a straight face. It's really interesting to be a doctor. But very serious things that he's saying there, Linus. 200 plus cases August or September. But now we have 80 cases in one day. We never thought we would get here.
We never thought we'd get here, Joe. And I remember when the cases were about 3 in a day, sometimes eight in a day. And what has happened today, especially with that statement by Dr. Amoth, it should really raise the attention of Kenyans about the seriousness of this situation. Not just the seriousness, but how long it's actually going to be around, because there was this sense that maybe in June we could start normalizing. We are all looking at the 6th of June when the next 21 days curfew ends, as if it's going to be voila, it will be a good time after that. But what the ministry is saying, and the statement by Dr. Amoth there, should tell us that we're going to be in this for the long haul. And these comparisons must be drawn with the Spanish influenza of 1918, because it also started as if it's something that is just passing and will end shortly, but it lasted at least 2 years. I think we have reason to worry and reason to finally, as Kenyans, appreciate the gravity of this situation. This is serious.
In Jamila, we were asking for more tests. Now they are doing more tests. Today they have passed the 3,000 mark, 3,100, I think it was.
Yes.
And that is impressive in the sense that we have been saying, well, let's test and see how much of this thing is out there. And true to that suspicion, the virus is really with us in a very significant way.
That's true. The more testing you do, the more cases you will have of infections. In fact, today I heard the minister saying that they've increased testing by 40% in the past couple of days. We saw 80 today, we saw 66 yesterday, we saw 51 the day before, and the testing had increased during those days. In fact, right now we've tested about 52,500 people to date, and the number of infections is 1,109. Now, what they are seeing is that the age bracket from 18 to 39 are the ones who are most affected by the virus, and that is the most productive age of people, and they're the ones who are getting affected by the virus, but they're not the ones who we are seeing who are dying the most, because we have 50 people who've died so far, and the number has not increased in the past few days. We thank God for that. But what is coming out, Joe, and I was just listening to Dr. Lois Ombajo, and Linus just alluded to it. She's the head of infectious disease at KNH, was being interviewed by Trevor, is that she's saying we need to believe that it is no longer business as usual. She says she's attended to patients who've succumbed to the disease, and she's seen patients who have struggled with the disease, unable to breathe, and she says this disease is there, So we need to stop behaving like it's business as usual.
But you still hear Kenyans asking like, have you seen anyone?
Exactly. Have you seen anyone? And in fact, when we were listening to the press briefing, before we started hearing these cases of 60, 80, 50, we were hearing 20, 25. And it had become almost business as usual. We're expecting the minister or someone from the Ministry of Health to stand there and give us the press briefing and say, today we recorded 20 new cases. We even have memes, people saying they even have a template of how the minister will make the statement. And then when we look around at even stories we've done at Citizen TV, it is business as usual. We did one the other day in town at the bus stations, and it was normal. We don't have the sanitizers anymore. There's no water there for people to wash hands.
Even Kibra today.
Even Kibra today, we saw the story that Sikolia did, and he went there and people are drinking there and it's life as normal. But that belief that some people do have that this disease ni story tu haiko, people should understand that people have died from the disease. And as the World Health Organization told us, this is a disease that will stay with us for a very long time. We need to find a way ya kuishi nayo. But we also need to be careful about it, because it's not a joke.
Francis,
you know, I'm looking at not just the 80 new cases reported today. I'm looking at the totality of it. 1,109 cases, out of which 50 fatalities, 375 recoveries.
Yes.
So we're talking about 613 active cases. Look, if 3,000 tests are generating 80 positive cases, and you hear what Dr. Amod is saying, that if we test, let's say 4,000 and we get about 100 positive cases, then we shouldn't be surprised. That is not the issue. My concern is our state of preparedness to deal with the increasing numbers. Have our counties been beefed up in terms of equipment, in terms of medical personnel, in terms of the necessary facilities to deal with this situation? Because 613 cases active, where are these patients? Because initially we were talking about Mbagathi. It doesn't have the capacity to deal with all these cases. Look at KU, it doesn't have the capacity to deal with all these cases. So look at the number of counties that have also been affected, 22 plus. So it means there's a greater concern, not just in Nairobi, but even across the country. In the event of an explosion of these infections, these community infections, are our county hospitals able to deal with the increased number of infections? And if you're saying by August we'll be dealing with 200 to 300 cases per day, then it means the state of our preparedness needs to be the first priority. Yesterday I had the chairman of the Council of Governors, Wycliffe Oparanya, still complaining that there are concerns in the counties. So if these infections are increasing in the counties and across the country, so to say, then we have a big reason to be afraid. And what is the cost of managing one patient? Just one. What is the cost? And multiply that by the surging number of infections. So therein lies a big concern that we're going to require more personnel, we're going to require more facilities, and bear in mind that 50 plus years of independence, our health system has been heavily neglected. So we are dealing with a pandemic, but at the same time, reaping from what we didn't do for all those years, neglecting our health sector. And where huge monies have been stolen, the Ministry of Health has been one of the ministries where money has been stolen. So we're also paying for our sins of the past.
Wow. Additionally, Joe, to the point that Francis is making, 200 a day, what we'll start seeing is not just pressure on the facilities, but also pressure on personnel. We will suddenly be in a situation where we are not able to handle the numbers that are coming in. My only consolation, and I hope the ministry can advise us on the severity of the infections in Kenya, because we have not gotten any statistics telling us, for example, how many ventilators are in use, how many are occupied, how many of these infections are getting serious to the level of critical stage, going into the ICU, because those are good indicators to tell us what to expect. Because 200 a day, now break that again into severity. How many ventilators will be occupied? How many ICU beds will be occupied? I worry about that because this is exactly how it went in Italy, because suddenly a first world healthcare system started struggling. Ours, like Francis, you are pointing it correctly, is going to struggle. And not just because of the underinvestment, but also because I don't think there is a health system that is prepared for this magnitude of an outbreak.
And to think that this has happened, I mean, this exponential increase that we're talking about in the month of May alone, I mean, when we're starting this month, we were at, I think, 396, and right now we're at 1109. That means about 713 or so just this month alone. And to your point, Linus, I think there's a question here about, and we've been talking about it a lot on Newsgang, about looking critically at our unique circumstances and the unique way in which the disease is presenting itself here, and trying to find ways in which we can deal with it differently based on the shortcomings that we have in our healthcare system. Because if it is being said that a majority of the people that have this thing in Kenya luckily are not getting the very serious kind of complications that we've seen somewhere else, and yet they are actually being kept in all these health facilities, and we run the risk of overrunning those facilities in the future. That is why I think in March, the middle of March, there was a draft policy that came in the ministry. I don't know why it's not been rolled out, but there was a time the ministry was considering how they could activate home-based care for some of the patients that are not so badly off, so that the health facilities are left for people who will be very serious. Because the more cases you have, even if, for example, like now, the death rate we've seen here is about 5 point something %, if you get to a situation where very many people are in critical condition, because the more people you get, even if the percentage of people who get seriously ill is just 10% or whatever, and it's 10% of what, like of many people, then it means the health facilities will be in problems. Shouldn't we be, Jamila, thinking more about how else do we take care of these people who are not seriously ill but still are a risk out there in society, so that they are confined to some places but they are not congesting health facilities that could be helping other people who are suffering from this disease, or who indeed are suffering from other diseases which we all know have not taken a break.
It's true, Joe, you make a very valid point, because we even hear about the number of people going to hospitals to get treatment for other diseases has gone down significantly because of the fear of getting infected. People believe that if they went to a hospital, they may get the coronavirus. Even children, immunization, you told that the number of children who are going for immunization has gone down significantly because of that fear. But something else that we need to think about, Joe, is that this disease is about, what, 5 months old now? And we are still seeing new symptoms. Different symptoms. In fact, today I remember the minister was telling us, Mutai Kagwe, that they're seeing cases not locally yet, but internationally, of young people getting strokes, just because they've gotten the COVID-19 disease. And then I think a few days ago, the UK now has included loss of smell or taste as a coronavirus symptom. So this is a disease that keeps changing. And we're even listening to Dr. Ombajo says, this is a virus that will keep evolving. It will keep changing. So, and they don't know a lot about it. So kila siku ni kujifunza. Another thing, it's something that we need to think about as a country in terms of how well we'll be able to manage if the numbers keep growing as they are. Countries like the US and the UK and Italy and Spain of this world really are suffering. And in fact, some notions that in the beginning they used to say, oh, children are not affected by the disease. Here in Kenya, we've had 40 children under 9 years old who've gotten the virus. In fact, we had a 6-year-old child who died. Now, the other worry that comes about now, deaths associated with coronavirus, and it's something that the president spoke about, is that 30% of the deaths that have occurred happened at home. That people died in their homes, and it was discovered that they had the disease after they had died, which means they had put the people who are taking care of them in danger. And because if we're taking care of you, now corona and we didn't know, and after you die, you find out that you have it, it's actually a big concern that people have, because how many people could have been affected by that particular person? I think it's one of the issues we need to think about going forward in terms of now even reporting. And if you just get a suspicion that someone could be having this virus, of course the symptoms they keep telling us about shortness of breath, about fever, about cough, about fatigue, about body aches and pains, you should actually just go and get tested. In fact, at Aga Khan Hospital, if you just go to be checked for anything, they test whether you have the COVID-19 disease.
There's a greater danger, Joe, as we depart that discussion. I'm looking at the breakdown of the numbers, the 1,109 cases. The ages between 20 to 59. Out of 1,109 cases, 900 cases are between the ages of 20 to 59. Actually, the ages between 20 to 29 are 298 infections. The ages between 30 to 59 are 611. That leaves 200. 290 90 cases are for those who are 6 years old and above, and then 110 cases are for those who are below the age of 19. You see, initially, the discussion was that this is a disease that is affecting people who are above the age of 58 and above. And it wasn't seen as so much of a disease of younger people, but increasingly it's becoming a concern for the younger people, actually more than the older people. Look at the age 20 to 59, 900 cases, then it should worry us greatly.
Yeah, and I think the other thing that has come out, Linus, in the last couple of days, actually before the numbers started spiking again, there was a lot of discussion about easing things, like you were alluding to, that, you know, should we start thinking about opening schools? Should we start thinking about reopening hotels and lawyers pushing for the reopening of courts and that sort of thing? Should this not be a moment for us to pause and say, wait a minute, should we actually be talking about this, or should we in fact be thinking about ways of making things a little bit tighter? Because we have had all these restrictions in place for, I mean, if it's the curfew, we are basically talking about almost 2 months now, and yet the infections are going on. There might be a discussion whether in fact the restrictions in place are enough, whether people are actually obeying them, whether they are being enforced enough, whether they are having the impact they were intended. Like, what is this that can explain the fact that we have restrictions in place, but now the numbers are going up and up and up? What is that right conversation? Because it's confusing at this stage, isn't it?
Right. Joe, those numbers alone would render the conversation irrelevant. The discussion that we should be reopening anything instantly becomes misplaced if you look at the kind of trend. Remember, we were talking about opening restaurants when the infections were way below 400, if we could remember. So the numbers, as they rise, the reality strikes, and it's all sectors of society. And we saw Wilson Sossion speaking the other day, and only saying, look, parents will not let their children go to schools against those numbers. And it makes perfect sense. Parents will not allow children to go to any school that has been opened when the numbers from the Ministry of Health are still looking like that. Look, there's something else that is happening, Joe. We had a lot of problems as a country when it comes to changing the social behavior. But something will enforce that. One is the numbers. Two is, finally, people are starting to see the coffins, that there is a link between coronavirus and death. And when you see those people who are dressed in personal protective gear, a coffin wrapped in nylon paper, it looks bad. You know, these were images that we used to see from Ebola-affected countries.
And the early days of HIV.
And the early days of HIV, to which there is a response in the public that immediately turns around the behavior. You know, credit should go to the people in the countryside. Because in the countryside, if you look at the people that sneaked out of Nairobi and ended up in their villages, they have been reported by villagers to the police, to the chief, you know, and somehow to the authorities that so-and-so has just arrived. Because they do understand, they're watching these signs and they're starting to take things seriously. So it'll be very, very interesting to see what the president and his team would tell the country on the 6th of June, considering what is happening with these numbers, Joe.
That's the day when the extension of the curfew and the cessation of movement will be ending. And a very interesting conversation that's likely to happen there, Jamila. The numbers are growing, and the number of counties in which the cases are being seen is also growing. And that is an interesting thing, because it means that this thing is spreading further and further in the country. And because now every time they increase the number of tests, we get more people, it might suggest that it is only a matter of time and we'll be seeing even more cases, because as long as people are walking around and they do not know that they have this thing, they will probably not be as careful as they would if they knew something. And that we have seen in the worry that you expressed about people who have died at home. People have been nursing them, giving them uji and, you know, making for them the bed and whatever, and holding them and not taking any special precautions. And then suddenly this person dies and, you know, it was COVID-19 after the fact. Isn't this something that we really need to worry about the countryside? Because remember, the conversation initially was that we need to be even more careful about the countryside, because a majority of the 3 million or so elder senior citizens of this country live in the countryside. In fact, I think I had a government statistic that said only 160,000 of the 3 million actually live in urban areas. So it means that some odd 2.8 something million elderly Kenyans live out there, people 60 and above, and those people we know are more vulnerable. So what is this to be done about this? Because we've locked out Nairobi, we've locked out Mombasa. It doesn't seem to have helped.
We've locked out, but Joe, people are still going home. Yeah. In fact, today the minister was insisting, you were saying, stop going, acheni kwenda. Yeah. And it's up to the onus is on our security apparatus to make sure watu waache kwenda nyumbani. We had the people who toroked KMTC, and the next day they were in Litein, they were in Kericho. We had people from Kibra who ended up in Siaya, and they took because today we had 7 infections in Siaya. And as you say, people back home hawana hii ya sisi watu wa Nairobi kuzunguka na mask, kuna sanitizers kila mahali, kuna nini. I don't think for a lot of people back home it has really set in that this disease iko hapo inaweza kumaliza watu. That's why we really need to be careful about going home. COVID-19, yes, affects everyone. Anyone can get the virus, but it's more serious in older people because of all these pre-existing conditions, people who have diabetes, people who have hypertension, and it's dangerous for them. And that's why it's up to us to stop traveling and going home. Kama ulivyosema, there are some counties where the disease is being seen now that wasn't before. And if people keep traveling and keep moving around, you're going to take it to each and every county in this country, and we're going to be overwhelmed. Gashuri and Lina has talked about how our health system cannot really handle a full-blown pandemic. About ICU beds, ventilators, personnel, equipment, we don't have them. That's why we need to make sure that watu waache kusafiri kwenda mashinani kuwapelekea wazee huu ugonjwa, because we will see an increase. If that happens, we'll see an increased cases of infections and more deaths, and we really, really don't want to go there. And I need to say this also in my end, because the only month of Ramadan is ending. And for us as Muslims, usually Eid al-Fitr is a big deal. We get to go and visit families. We get to eat a lot of food. We get to go take our children to places of entertainment. That is gone. There's nothing like that. In fact, if it was last year or previous periods, like now, people would be busy in shops, buying clothes, buying food, women buying buis and clothes for their children and kanzus. But that's not happening. Business has been adversely affected in Eastleigh and in Mombasa. In fact, after the closure of Marikiti, people are going to Bondeni to try and buy a few things here and there. There'll be no prayers at the mosques or in the grounds. There'll be no taking children for merry-go-round or any of those things that we used to do. This is now a different time, and we accept it, because it is the only way we can all remain safe, sisi wenyewe na watoto wetu, because religiously it is very important for us to go pray together somewhere, sali, or is it at a school compound or something, but we are unable to do that now because of this COVID-19. It's painful, but it's something that has to be done just so that we can protect ourselves and protect others. I remember, I think it was Minister Mutahi Kagwe who said, when you're walking around, assume everyone else around you has the virus and they can give it to you. So walk around thinking that.
All right, living to fight another day. Yes, when we come back, some big fight happening at the border between Kenya and Tanzania, and it's all about truck drivers and the virus, and 2 presidents have now stepped in. We'll discuss that when News Gang returns in just a moment.